Hello, Jenny.
That's better.
Bit of an echo.
That's better.
You've got sort of like a golden glow
I
behind
know.
you.
I'm on fire. Okay, so that's working. Good. Right, I think we're good, Councillor. Let's try again. Councillor Ralph, can you hear me? Oh, man.
Yes, I can hear you.
Oh, thank you. Okay, so we're now being recorded again, so we're back on being live.
Do we know where we left off from? We just start from Basildon.
Yeah, I mean, all I got was Councillor Holloway's minutes, changes to the minutes. So if we could start from maybe urgent items of business again, I do apologise.
That's okay. I did wonder why you had a puzzled look on your face, Jenny. Right, is everyone back in, or are we still waiting people to join?
I believe most are back online, so we're good to go.
Okay, brilliant. Right, okay. Item 3, urgent items of business. I have not agreed to any urgent items of business. Declarations of interests. Did we have any declarations of interest? Nope. On that one, I did say that for myself, as I'm currently doing some courses for Mind, it should be noted. Items 5, items raised by Health Watch, Kim James.
Nothing from me this time, thanks, Chair.
And our lovely chat's gone, they didn't hear it. Okay. And we do have Claire from Basildon Hospital. Again, so item 6 on the agenda. The update report can be found on pages 19 to 24 on the agenda. Could I please ask Claire to come and once again start your presentation? Thank you.
Thank you very much. And thank you for having me back to give you an update on the maternity unit at Basildon. I'm pleased to say that progress has continued to be made with the improvements in the service. And we know that because the number of serious incidents has reduced, the outcomes for women and babies have improved. Feedback from women who are going through the unit is also good in the significant majority of cases. And we also have a number of external visits into the unit through our local commissioning teams and our regional lead midwife who come in kind of regularly and unannounced and report back to us in terms of progress that's being made on any outstanding issues. As I said earlier, the cultural change in the unit, will take some time. This is not a 3-month improvement plan and then we kind of move on to the next thing. It's going to need continued focus, but I can definitely report that we are moving in the right direction. A major capital project has started to improve the quality of the environment in the postnatal and in the labour ward, and that will make a big difference because if any of you know the Basildon maternity unit, it's been in need of some physical improvements for quite a long time. We've got some new leadership. We've had interim leadership in place, and there's a transition period at the moment where the head of midwifery from Broomfield Hospital has now started at Basildon this week. And we have a new clinical director who will be starting in April, supporting Mr. Singh, who will move into the medical director role for the entirety of the maternity service across Broomfield, Southend and Basildon. We're out to recruit for a director of midwifery who will also take on that same PAN trust role. So that will provide additional leadership. And we have someone starting in April called April Brown, who will be an improvement director, who will focus entirely on the maternity service. So quite a lot of additional resource in place. We've had some external consultancy support to make sure that our governance systems and structures are absolutely robust and fit for purpose. And we will continue to kind of keep stress testing those to make sure they're doing everything that we need. We have a new role, which is about engagement with women and partners. So Leslie Overy is in that role, and we're leading a piece of work now with regular engagement events. There was the second one last week, to get really user feedback into the development of the wellbeing and pregnancy strategy, which will be how we sustain those changes and that kind of women-centred care going forward. So I'll stop there if that's okay. I'm more than happy to ask questions, as I'm sure you've got.
Thank you so much for your report. Unfortunately, I'm having a little bit of connection issues, my end, so it was breaking up a little bit, but I did report. I'm very much aware of the amount of scrutiny that your department is under at the moment on this, the maternity department. I know we're not the only ones looking into it, and I appreciate all the work that is going on. And again, I'm quite happy that you are being looked at so closely, being how the reports were on the last one on the 15th, as on September as well. I'm encouraged by what you're saying, even more so than what was in the report. Now, hearing you speaking about it is more encouraging than some of the stuff that's actually in the report and what you're doing with the appointments and all this that's coming in. I'm just going to hold my thoughts and see if the next person coming. I didn't actually see who was first, so I will go with Councillor Modoni.
Thank you, Chair. Thank you, Claire, for this report and for coming back to present it again. I welcome this report. I thought it was very good. There's obviously a lot of progress being made. I really am grateful that you acknowledge that it is a long-term process, because last time my concern was we kind of had this kind of process, and then again the same problems seem to arise. But I thought in general, as a whole, it answered a lot of my questions. There's a lot more in here now about the voice of the patient, the moms that are actually using the service. I can see that that's running throughout what you're doing, and also staff voices. I had a couple of questions. The first one was in relation to the one-to-one training of each band 7 to own any of their own incidents to close them down. I wasn't quite sure. Can you say more about how that works, and what's the feedback been from staff about this?
Yeah, of course. So, I mean, on a labour ward, on any maternity unit, there are always lots of incidents that get reported where, not necessarily where things have gone wrong, but where they had the potential to go wrong, or where there was a piece of equipment missing, or there may have been a staffing issue. Staff are encouraged to report if they don't get their breaks, for example. So there's a high volume of incidents that get reported on a daily basis, some of which are very minor, others of which could be much more serious. And in order for us, our service to be a kind of learning and growing service, we need those people who are running the labour ward on a daily basis to be reviewing the incidents that are happening, making sure they are taking appropriate action where it's needed, and feeding back to the staff who've raised the issue what action has been taken as a result. And so in the past that might have been done by a kind of central team, but in fact, if you want to really learn, and you want to share that learning, and you want the staff on the ground to know that you've taken the concern seriously, the feedback loop has to be rapid. And it's better when it's their kind of managers who on a day-to-day basis who are taking the lead for that. Obviously, if there's a serious incident, then that gets escalated, and then there's a daily executive-led review group which makes sure that anything of a more serious nature is properly and thoroughly investigated. Does that help?
Yes, thank you. that explains that very well. And staff are happy with that, presumably, because they're getting more rapid feedback and they're getting more rapid action on if a piece of equipment isn't where it should be, etc.
That's exactly it, and it's that rapid feedback and action being taken rather than going into a machine that kind of disappears off for months and you don't hear any feedback as a result. That this is what this is really trying to address.
Yes, so it's really good to read about the co-production, about some of the things that are still in progress, some of the things that are in place, obviously. Great to see that the attendance at multidisciplinary working and the safety huddle in particular, it was really great to see that attendance up because that felt so important. Obviously, there's recruitment outstanding.
Yes. And that's probably the biggest area of risk, isn't it? Because we know that qualified midwives are in short supply. So, you know, recruitment is a particular concern for us.
What are you doing about that? Because it is, I mean, it's a national issue, isn't it? So
So I mean, one of the things that we're really pleased about is that all of our student midwives who qualified in September stayed with us. So that's obviously a really good marker of the fact that they felt that they had a good supported experience and that they chose to stay in the unit. But that we need more than newly qualified. We need experienced staff as well. So we're taking more of a kind of campaign approach rather than just doing the normal kind of advertising. We're trying to do something which is a bit more attractive, a bit more systematic. And for our director of midwifery post, we are using headhunters to try and find the right person, because local and national advertising hasn't done the trick so far.
Right, okay, thank you. Obviously, then there's work in progress, and thank you for your update. It was good to see the upcoming milestones because obviously you produced this report a bit before the meeting. I think for me, I think good progress is being made from the report. I like to see it coming back again at some point. Would you say 6 months is a good time frame to report significant progress?
Sorry, I don't know what happened.
Yeah, Councillor Mulvaney, that was coming to that for the recommendation of 6 month return. So yeah, I'm glad you're one step ahead of us there. So yeah, that will be what we'll be asking for.
Sorry, Claire.
I've completely froze then.
Okay.
And so I've been offline for the last couple of minutes. Sorry.
Oh, right. Okay. I mean, I don't think I said anything. It seems like good progress is being made. Good focus on co-production and a plan for going forwards about how that's going to happen. But obviously, we're not there yet. You're not there yet. So I was just suggesting maybe cut this report coming back in 6 months' time. Would that be a reasonable length of time to show progress?
Yeah, I'm happy with that. I think that's absolutely fine.
Thank you.
Thank you, Councillor. Councillor Essill.
Thank you, Chair. Thanks, Claire, for your input. I don't want to go too much down the past because you seem to be learning from the mistakes that have gone on and seem to be coming forward in that. Councillor Mulvaney has bordered on something I was going to ask about. What you just got 2 questions really. What are you doing about recruitment, and what are you doing within the hospital to, in the COVID situation we're in at the moment, what are we doing to help mums have home births?
Yeah, so the demand for home births is relatively low, but I think the latest figure was somewhere between 2% and 5%. So we do have a home birth team, as you know. It's not, if I'm completely honest, it's not been the top priority lately because obviously, from a staffing perspective, the high risk area is the labour ward, and that's where we need to concentrate our resource. But any woman who does want to have a home birth, we do facilitate. And in terms of recruitment, sorry, I couldn't hear that.
What are we doing for recruitment? What measures are we putting in place?
well, trying to take a campaign approach where we're making the opportunity to come and work at Basildon attractive, offering training and rotational posts. You know, just trying to be as flexible and offer as flexible working where we can. So all of the things that you kind of, you know, you would expect us to be doing, but there is a national shortage of experienced midwives. So we're in a very, you know, competing in a tight market. But what we know is that at Broomfield, for example, we're almost fully recruited. So there's something very much about the reputation and the support that staff get that make them want to come and stay when they do. And as I said, that the bit about the student midwives or when they qualify staying, I think is a really good start.
Brilliant, thank you.
Thank you, Councillor. Yeah, I say, you know, hopefully, you know, with fresh eyes, looking over this from within now, with the new recruitments that's taken place, you know, going on with councillors, that we would like to see this back on the work programme, say in 6 months' time, to see how you're getting on. There was just a few things. One of the councillors has covered it, and that was how you're dealing with the pandemic at the moment. Hearing back on the feedback, my question was going to be about home births, so that's covered as well. So that was quite good. What I was wondering,
Would you like me to? Oh, sorry, go on.
Oh yeah, sorry.
I was going to say I could say a couple of words about COVID more generally if you want to at the end of this item.
Yes, yeah, that'd be great. Thank you. One of the things was the red flag reporting, and you're saying you're getting a lot less of those at the moment.
Yeah, definitely. So all the training we did during the summer, in terms of the interpretation of the monitoring of women in labour, what we call the CTG training, we believe has really materially impacted upon early recognition of complications during childbirth, and have led to less incidents occurring as a result. I mean, that would be the one big thing that we could point to. I think the change in the safety culture, the huddles and all of those other things we think are also contributing.
Yeah, I think that's what it is, an ongoing procedure that you're doing there, and each section that you put in place has a knock-on effect, a positive knock-on effect, we hope. So with the COVID thing, are you facing more restraints on your care services that you can offer with them?
So for maternity, the big challenge has been around visitors, and that was very problematic in terms of not allowing, you know, partners not being able to attend. We have introduced testing for people coming into the maternity unit, so that's a big plus. So we can, you know, allow women to be better supported during their ultrasound visits, their outpatients, and their delivery. So COVID has been, you know, really very significant for the whole organisation, but probably less so in maternity, where our infectious levels have been, you know, much lower than in other areas. But infection control procedures are obviously very important.
Was you affected much by staff shortages this time?
Well,
self-isolation.
Yeah, I mean, absolutely. I couldn't tell you off the top of my head how many of our midwifery staff were off, but as a total number, you know, back in January, we were missing 1,000 staff across the entirety of the trust. So, you know, that's a huge number when you think about, you know, the workforce on a daily basis.
Oh, brilliant. Thank you. Does any other councillor have any questions? No. Thank you. Oh, who was that? Sorry.
Sorry, that was me, Chair, just to say no hands up.
Thank you, Jenny. Okay, Brent. Well, thank you for Paul, and you know, hopefully we'll see you again in 6 months. Thank you for attending tonight, and you're free to go if you wish.
Thank you very much. Thanks
Thank
a lot.
you. Okay, item 7, the Worklessness and Health and Safety Joint Strategic Needs Assessment. This report can be found on page 25 to 110. Could I ask Andrea Clement to introduce this, please?
Hi, good evening, everyone. My name's Andrea Clement, Consultant Public Health. I'm just going to give a brief overview of this paper before inviting any comments or questions on it. So the Worklessness and Health Joint Strategic Needs Assessment has been developed to gain an understanding of the relationship between worklessness and health, and also the scale or the size of this issue in Thurrock. This is a really important issue because we know that assisting people to return to work has benefits from both a health and well-being, but also an economic perspective also. So on an individual level, being at work is vital to a person's ongoing recovery and overall sense of well-being. It can also mitigate against some of the chronic physical and mental ill health effects of these conditions, such as higher medication intake, for example. On a societal level, obviously we have the cost of sickness, which can be reduced, and there was some Public Health England modelling, that suggested that substantial savings, I think it was up to £12,000 per person per year, could be saved for each person that returned to work, and so those savings spread across the NHS, local authority and central government. So the focus of this Joint Strategic Needs Assessment was working age people, so those aged 18 to 67 who were receiving employment support allowance, and my public health colleagues who produced this paper decided to focus on those who have mental health and or musculoskeletal conditions. They decided to focus on this because we know that these are the most prevalent conditions in the workless population, both locally and nationally, and we also know that these conditions have a complex and often reciprocal relationship also. So the aim of this JSNA was really to understand the barriers to employment in this group, and then to identify any support that was perhaps needed over and above what was already in place to overcome these barriers. I'm just going to briefly summarise the key findings of the report, and then the key gaps before inviting any comments or questions. So in terms of the key findings, the report found that some types of musculoskeletal conditions are on the rise in Thurrock, such as osteoporosis, for example, and this is in line with national trends, so not entirely unexpected. In terms of common mental health conditions, there is a significantly higher prevalence of these conditions in Thurrock if we compare ourselves regionally to the east of England. However, as you would expect, there is variation across the borough. So in those areas of high deprivation, there is larger numbers of people claiming for these conditions. In terms of the key barriers to work in this group, these were found to include things such as stigma, pain, low expectations of health professionals, and a lack of understanding or education of employers. In terms of the local specialist offer that is currently available to support people back to work for people with mental health conditions, it was found to be really quite comprehensive. So had services such as individual placement support, which helps people with severe mental health conditions return to work, to signposts, which helps all unemployed people with training work readiness. There was also quite a substantial community offer as well around volunteering and shadowing, which, as you can expect, has a large impact on confidence and self-esteem, as well as skills development. In terms of musculoskeletal services, the offer was more limited, but this is something which is reflected all over and as well in the literature in terms of what is evidence-based. However, since April 2020 in Thurrock, we do now have the Community Musculoskeletal Service, which is commissioned by the CCG and delivered through the Thurrock Health Hubs. As I say, it's quite a new service. It's only been up and running, I believe, since April. So there's no outcome data available on this at the moment. So I think this is an area that we need to go back when that data is available to assess whether or not there is any sort of further system support or anything that needs to be put in place around that in terms of bridging that gap then to people getting back to work. In terms of the key gaps, I think that the main key gap really was that there was no overall strategic approach to worklessness and health. And as I've just said, whilst there was a variety of local services available, sometimes, not always, but sometimes the access to this support could be unclear and disjointed. And some of the feedback from the focus groups was that these services were not always person-centred or flexible in their approach. Importantly as well, the report found that there was no overarching workplace health accreditation framework across Thurrock. Some were using different frameworks, some not at all. And this really makes it difficult to quality assure those frameworks, and for us as a council to provide support to employers in making sure that they're working to keep their workforce healthy and well at work. A couple of other points in terms of, firstly, around fit notes. So it was found that these don't consistently detail what a person may safely be able to undertake on their return to work. Again, this is a national issue. It's not just an issue in Thurrock. There has been some guidance that's coming out nationally that's sort of encouraging other healthcare professionals, such as physiotherapists, for example, to input into those fit notes. But I still think this is something that needs working on further. And then finally, the Disability Confident Accreditation Scheme in Thurrock has a really limited uptake. Again, I'm not sure from this report why that is, but I think this needs to be investigated further, and perhaps as a council we can encourage that and get comms out, for example, around that, and encourage employers to sign up to that government scheme and get that accreditation. So just before I finish up, just to quickly mention the recommendations. So you'll see in the report that there is several quite detailed recommendations. I'm not going to go through them, but I think that they can be categorized into three overarching recommendations, really. And I think firstly, and probably the key and the main overarching one, is the development of a worklessness and health strategy. So this would have a focus on both prevention, so keeping people at work in the first place, having a healthy workforce, but then also assisting a timely return to work for those people that do become workless. And underneath this, there would then be a framework of actions that would help drive that strategy through to implementation. The second two, I think, overarching recommendations do come under that main one, but just to mention them in their own right. So secondly, the development of a clear pathway that joins up all services and allows claimants to be given the right support at the right time, or the most appropriate support, and again in a timely and appropriate process. And then finally, as I've mentioned previously in the gaps, the development of or adoption of a standard healthy workplace accreditation scheme for Thurrock, which again helps to ensure good practice in relation to health at work and enables us to then support local employers in delivering that. So I think the next key step after this production of this JSNE is to start producing and developing that worklessness and health strategy. So as you're probably aware, the council is also currently producing an economic development strategy, and as you can imagine, there is going to be quite significant overlap between these two strategies. So I really don't see it sitting as something completely separate. I think this worklessness and health strategy will almost kind of sit underneath it, really, particularly around the kind of building resilience and those workplace wellbeing programs, which will be part of that economic development strategy. Just to note, just briefly at the end, is that I think alongside developing that worklessness and health strategy, we do need to go back to this JSNA document and refresh it in some ways, because this was produced prior and during the pandemic, and as you would expect, we could estimate that the pandemic has an impact on this population, and we need to go back and assess what the scale and the type of impact that has had alongside the development of the strategy. And on that note as well, I think we also need to look at another area which wasn't covered off by this JSNA, which was the impact of universal credit as well, which again wasn't tackled with this. So I think those are the two main areas that we need to go back and refresh. However, I do very much see this being a live document that we're continually reviewing and inputting into that strategy. So I'm going to stop there and just invite any questions or comments, please. Thank you.
Brilliant, thank you. It was a very in-depth report. One of the things I was going to ask you sort of just covered just now, and that was the impact of COVID on the amount of people that will be coming through the services now and how that's going to change. Reading through it, on the side of the community liaison officers, are we going to be seeing more of their involvement in all sides of what happens with job recruitment and mental health and other illnesses. I know at the moment they can be very limited in what area they are be dealing with, who they can link up with. Will they become a more major part of the strategy as a whole?
I very much see this strategy as really being a systems approach. So we want, it's not just the council and sort of, you know, limited other organisations. We really want to kind of get all sort of partners involved in driving this strategy forward, almost sort of a whole systems approach. So, and to make it joined up, I do think that we need that engagement, involvement of all different partners. So yes, I would see that ideally being the way forward. Yes.
Yeah, it's definitely a bigger project than just having, say, you know, signpost dealing with everything and all that. A joint strategy is definitely sort of the way forward. I'll bring in Councillor Holloway first.
Thank you, Chair. I'm going to lower my hand whilst I remember as well. And yeah, I hope you'll bear with me, Chair, because I've got a few questions and I know other members will want to come in. So if I do go on, I'm happy to stop and come back in later if that's okay, Chair. I will say, first of all, thank you. I know that these kinds of reports take an enormous amount of work, and I have got enormous respect for that public health colleagues for putting all of this together, very much so. I know it takes a lot of work, so thank you. I'll also say that it is an issue that is quite close to my heart. I've worked for a couple of disability charities in my career, and was actually working at one of those charities when the Welfare Reform and Work Bill, now Act, went through, which made some changes to the work-related activity group, sadly cutting the money that went to that group by £30, aligning it to a JSA line. So I'm kind of coming at it from that angle, and because I'm coming at it from that angle, I am a little disappointed with the report, from the fact that I'm concerned that the focus on money really as a key driver, rather than a focus on health, and how really again, it's something, it's text and messaging that I've seen previously, especially around musculoskeletal and mental health being one of the largest claimers of disability benefits, and a government that wants to get these people back to work, because of the cost they are to the economy. People in the work-related activity group are part of employment support allowance, have been deemed fit too ill to work and should only undertake mild, short amounts of work. They can't work full time. They're not in the JSA group. They're not in the support group. They are unwell. They shouldn't be working. And yes, they need that support. My question, one of many, is firstly, why have we got this JS and Hay now at this point? That's my first question. Because and my second, I just want to drill down into some of the figures. I'm concerned about a big as issue as this is for Thurrock. How big an issue is this versus how big the government want to make getting people back into work who are sick, which makes me sick to my stomach, but I won't focus on that. What is this? Because on page 57 it says that 600 people aged between 18 and 67 claiming ESA due to a musculoskeletal condition, and then on mental health, those that could be supported back to work would be about 350. But then when we turn over the page and we look at kind of some extrapolated figures from national guesstimates about how many people, the assumptions give us kind of a wider kind of number of people. I guess I want to know what's the problem, and why have we looked into it? Is it a massive problem for Thurrock? Is where I'll start, please.
Hi. So the work on this started back in, I believe it was 2019. So it has been quite a long time coming, this report. So just a caveat, so some of the data will now be out of date. And I completely agree with what you're saying in terms of in that ESA group, there is that sort of much smaller subset of people that potentially could be supported back to work. And I think that is the subset that this JSNA is focusing on. It recognises that some people are too unwell to go back to work, but it's those that could possibly be supported to go back to work, which is the focus of this. So I know that those potentially on paper look quite small numbers, but I still think that because we know that work is an important determinant of health, I still think it's albeit a small group, a group that's worth focusing on it if we can. Appreciate that. So there's bigger numbers in other groups that could also be focused on, but I do still think it's an important topic. So I do appreciate your comments as well. Sorry, can you? Which questions were left? Sorry.
No, it's I guess, well, I know the report was from 2019, but what prompted it? Yeah, what prompted the report? And oh, sorry, Councillor Ralph, I can see you're trying to talk. I'm happy to let other councillors speak and come in.
No, it's just I think Mark is going to come in with a comment on that as well. So, Mark. You're still on mute, Mark.
What can I say? It wasn't a direct response to Councillor Holloway's comment. It was a separate comment. So I'm happy to come in after.
Okay, thank you. Councillor Holloway, would you like to make your next question, please?
Thanks. I think one of the other issues I have with the report is the term worklessness. I think it's horrid. I'll be very frank. I'm not going to mince my words. I think it's horrid. I know that it's a well-used term at the DWP, and I'm sure others. It's horrid. I think anyone, it's just, someone described being in a worklessness group has horrible connotations. I don't think we should use it. I don't like it. I think it's horrid. So please, if we can change it to something else, I'd appreciate it. I really do also think that maybe it's just the way the report was put together that, I'm just upset by the focus on the finances. I really am. I also think that there isn't enough emphasis on an analysis about what kinds of jobs there is in Thurrock. We have a massive retail, massive, warehouses and logistics. What's the likelihood of matching jobs with people with these conditions analysis? And also the emphasis really, really needs to be, apart from the fact that should we really be pushing people, and that's exactly what's happening, into work when they really should be left alone to heal? Why aren't we talking about the investment in health services? Why is it, someone might not have, they're trying to find 12 months, 18 months before they can see someone to talk about their mental health, whilst we're trying to shove them back into a job, might want to invest in mental health services and they might get better, then find work. So I think it's just all topsy-turvy. It's wrong. It doesn't work. And I think just the focus is all off. I just think the focus is just upside down, wrong.
Okay, thank you, Councillor.
I
think that's more of a statement than a question.
I know, but to be honest with you, it is a statement because I think it's not good.
Fair dues to Councillor Holloway. I will say that I do have some sympathy in what she says. Working within mental health myself, I know that there is a fear when it comes to getting back into work, but I also do understand the positive drive and the pride and the self-esteem that people can find once they're back into work. And I do agree, sometimes that time period can be long from when they're trying to engage with services, but also know that very much aware that we do have people that are in that worklessness state can be for 10 years, and trying to get them back into some sort of job that they can manage. It does bring its own thing of self-esteem and confidence, and that could be the same with anyone that has any other health problems. It does give them a sense of pride again. So I do understand where Councillor Holloway is coming from on certain aspects of that. I am concerned when it starts talking about the finance side of it all, but no, for me, the worklessness statement is that worklessness state that we have where people cannot work. Bringing Councillor Redstill first.
Thank you, Chair. Yeah, Councillor Holloway, we seem to be on the same wavelength at the moment, because the worklessness I've actually written down. So I know I didn't like the word either, actually. It did seem to be a lot about money. I mean, I couldn't believe that 105 billion, you know, is estimated. And when we're saying doctors getting 9 people back to work pays their wage, doesn't seem quite right to me. It doesn't sit well with me. Very complex report, very good for putting it together. I just feel that, and I hate to say this on such a big report, but not enough of how it's going to happen or how you're going to get people back to work. And as Councillor Holloway said, you have to give those people time, whatever's happened to them, and we don't know, to get back into work. Perhaps there's some that I don't think, and I did read it, all of it. I think, you know, perhaps we should be giving them even getting into the voluntary sector, you know, to volunteer, to start speaking to people. It all helps, you know, because they all learn something. I wonder what your views are on that. But thank you for the report. It is complex, and there are a lot of things I didn't like in it. But I think we should be trying, if we're going to get people back to work, we've got to integrate them properly into whatever, you know, doing something in the beginning to get them to talk to people. It isn't straight back into work. As Councillor Holloway said, they've probably got something that they need that time to get back into. But, you know, even in, like I just said, the voluntary sector is something, you know, even just to talk to someone on the phone is good, because you're taking perhaps their problems as well. It's helping them. You know, you're helping each other, really. I just want to know what your views are. Thank you.
Just before I bring Andrea back in, I think what we need to remember that this is only part of what we are offering in Thurrock. There's a lot of stuff that's been going on in Thurrock, and not the programs that we've been going on. It's that overall thing that's going on. I mean, there are development programs where we are looking at people getting back into some sort of voluntary sector work as well, you know, trying to help smaller things. I'm just going to bring Ian in first, just before Andrea answers.
Yeah, I just thought it might be helpful to try and answer some of Councillor Holloway's points. I feel slightly sorry for Andrea because she didn't actually produce this report. She was on maternity leave, so it kind of predates her. So just to give you a little bit of history and why we produce this and why we think it's so important. Firstly, work is the most health protective factor in anybody's life. There's indisputable evidence about that. So the more people that we can have in work that want to work, the better that is for the population in terms of population health. Secondly, I think it's an inequalities issue, actually. So what's really, really clear in the data is that there's a massive disparity between different wards linked very clearly to deprivation about the number of people with musculoskeletal problems or mental health problems who are unable or who are not in work, and that just really concerns me. So I think those were the two driving factors: one around health inequalities, and secondly that it is just being in work. If you want to be in work and are able to work, is the most health protective thing that we could do for our population. The third thing, I take your point about the money. I don't think we were coming at it from the way that you have concluded. So I think the focus on the money was to try and shake the decision makers in the system to demonstrate that actually this is one of the most cost-effective things that we could do as well. It always concerns me that you know, we spend billions and billions of pounds on you know, treating people when they become sick, and just very, very little on preventing people from becoming sick in the first place, or those wider determinants of health that actually have a much bigger impact in terms of overall population health. On that point, I don't think it's certainly not about forcing people back to work who are too ill. there's an element of prevention here as well. So we want to try and facilitate people from losing their jobs if they become ill. So working with employers in a proactive way to try and keep people who want, because most people want to work. Most people get, as Councillor Rath has said, it's part of their identity. It's a element of self-esteem. So I think it's about prevention as well. In terms of the how, this is the first point, the first part of that process. So as Andrea has set out, what we need to do now is to set up a strategy to actually deliver the how. And one of the things we are very keen on is to try and break down those silos. So it's absolutely not about forcing people back to work before they've been treated. In fact, quite the reverse. What I'm conscious of at the moment is that we have a lot of people who are maybe starting to develop mental health problems, that are accessing maybe IAPT, who, because of that, may be putting their job at risk. They're not getting maybe the help that they need quickly enough in the past. But at the same time, the DWP and the Worklessness thing sits entirely outside and separate to that process. And actually what we need to do is bring those together so we can be working proactively with employers to try and support people to keep their jobs. And if people have lost their job because they have hit crisis and want to get back into the workplace, we need to be facilitating that as part of their treatment. And there's some really good stuff that's happening with ePut, where this is successful. And if you look at the evidence base, you see that people who've had serious mental health illness that actually can be facilitated back to the work place recover much more quickly. So it's very much about breaking down those silos, not in any way forcing people back into work before that treatment has happened.
Thank you, Ian.
Chair, could I just come back on that? Chair, can I just back to Ian on that, please? Just to say, Ian, do you anticipate that the COVID situation we are in at the moment is going to produce more health problems with people getting back to work? Because this has got to have affected many people, especially people that are actually on their own in their home. It's done things that we're not used to. Many people are not used to being on their own. So do you think the COVID situation will do that?
So I think COVID has a kind of a double whammy, doesn't it? The social isolation may deteriorate or may cause people's mental health to deteriorate, and I think we're starting to see evidence of that, certainly with this last lockdown. But equally, the lockdown itself has damaged the economy, and that risks unemployment. So we have to find a way, again, of trying to bring those two things together. And I think this approach of trying to take a much more holistic view and to think about employment support and mental health, in an integrated way, is actually perhaps one of those solutions.
Sorry, Chair, do you mind if I come back before bringing Councillor Doney in, just so we don't get off point? Would you mind?
Yeah, of course.
Thank you. No, I just wanted to come back in. I really do appreciate, I never thought that it was the intention of the public health colleagues to kind of, purposely kind of put that rhetoric. I think it's just unfortunate that that's how it's come across. And I think as well, the point is that the key thing that you said there is, if people want and are able to, vast majority of people want to, of course they do. There's also a vast amount of people in that RAG group that don't want to and aren't able to, and actually should be in the support group, but that's a whole nother issue. And actually, I'll have to send you the report that I worked on when I was working on it in 2016, because this isn't a new issue. This is something that we recommended when I was working on it in my organisation with other organisations, to say, yes, it is about employers. Hopefully we can, and I really welcome the recommendation for us to have a Thurrock standard for employers. Really want to push on that, because disability confident, that doesn't work. You just fill in a form online. That's not a thing. No, absolutely not. But it's about national government saying to big businesses and to employers, treat your staff better, treat your staff well. This is what good work looks like. That has to come from a national level. Hopefully we can do it locally. I would absolutely love if we could, because most of the time staff have no rights. They're scared of losing their jobs. How do I pay my mortgage? And they suffer through bad treatment, ill health. This happens. hopefully we can do this locally. I'll definitely send you the report, which is exactly the recommendations we gave to this government back in 2016, and happened years previously as well. So worth a try if we can do it locally. I have no faith that this government will do anything about it nationally.
To reassure you, I completely accept your point that there is a cohort of people that are too ill to work and maybe will never be able to work, and this report isn't aimed at them. It's certainly not aimed at trying to force people back in employment. It's about trying to provide support and opportunities and prevention to people where there potentially is an opportunity, but they're just kind of left and they fall through the gaps.
Thank you, Ian. Thank you, Councillor Holloway. I mean, you have made me think, Councillor Holloway, as well, that when I come up with my footpaths project, was getting people through courses and back into work. I was able to connect with local companies, 24 local companies that were willing to take on people from my groups as either employers or volunteers. So I do have confidence we can do it locally.
I hope so. I would love actually for us to say to government, look, we did it here. Here's our example. Now go and spread this nationally. If we can be a leader again in that area, that would be absolutely magnificent. And I will do whatever I can and to support any way I can to engage businesses to take up our Thurrock standard of what we want to see from businesses. And I'm sure every councillor would. And I think we get that up and running. It works well. We can demonstrate that hopefully through figures and then get the government to copy us. I mean, that's something I can really get behind.
Well, I'm sure that if I can I've got 3 people back into work out of 12, and I've done that for nothing. I'm sure as a whole council, we could do it. And yeah, I think that's just positive. So out of this, we have come to a positive thing that we can work together. This is a whole thing. This is a whole thing that we'll be coming to. And when it comes to mental health, we talk about it with clients, and you mentioned the word work, and they have fear. They see it as a dark word, and a lot of it is due to losing benefits that they may be ridiculed when they go back to work, and also about control. They feel they're given over control, and when you've been suffering with mental health, it's about trying to get control of your life again, and they feel they're giving it over. Sorry, Councillor Mardone, you've been so patient. I'm going to bring you in for your question.
Thank you, Chair. That's fine. I think that was a very useful conversation that was had there. So thank you, Andrea, for bringing this report. And I'm so sorry that it wasn't you that wrote it. So please don't take any of this on board. I did find the price tags distasteful, but I think we've covered that. I looked at 2.2 on page 26, and that seemed like a good thing, that we were going to provide a comprehensive evidence and data analysis of the health and wellbeing needs of this population group, the musculoskeletal and the people with mental health conditions. But I couldn't, where was that bit? That was my first question.
Sorry, can you just, which page was that on? Sorry.
It's, page 26 of our agenda pack. I'm not sure if you've got that. It was in the, if you've only got your report. It's in Ian's report.
The covering pages.
The covering pages on the report. So not actually within the report. That was the bit that was missing. I couldn't work out how 950 people were costing £47 million to Thurrock, but perhaps that's been answered by the fact that not all of those, that would work out £50,000 a person. Is that really how much it costs? Certainly you don't get that on ESA. Is that number a bigger figure, ESA in general? But we're talking about 950 people that are targeted by this actual report. So that was the other bit. The third bit really was about COVID again. And there's a little table here on page 41. It's 1.3, the national picture for health and worklessness. So obviously these figures are very out of date. Now we've got a 5.1% unemployment rate in the UK at the moment, considerably higher than the 3.8% there, in fact higher than the projected forecast for unemployment in 2024 of 4.2%. When with this report is quoting 1.31 million unemployed, we've now got 2.6 million unemployed, and you know, we can only see that that's going to increase when furlough goes moving forward. We've also potentially got an issue of increased population with these kind of issues from long COVID, although perhaps not musculoskeletal so much, but certainly mental health issues. I know that there was a recommendation to do an impact assessment in terms of COVID. I think that was in the report as well, on the report. Let me just find the page. Oh no, I think it's within the report itself. I'm just wondering, you know, is it possible to start again and have the focus more on health and you know, what we're doing to support recovery from these problems, rather than what we're doing to, you know, get these people back into work. I mean, I know that you're coming at it from a holistic point of view, but I don't know if the DWP does holistic. And I just worry about how some of that might get used.
Hi, as I said, I think this is very much going to be a live document. I appreciate what you're saying, that the data is quite out of date. Unfortunately, I was just trying to quickly look through to see which bits you were referring to, and I couldn't quite keep up. But I do think the data in there does, you know, some of it goes back to 2017 or even earlier. So I do very much see, as we're kind of going through that process of developing the strategy, that we need to go back and just check, you know, any of those changes in the data where it is available, and get the most up to date data. And as well, in terms of the second point about refocusing on health, again, I very much see this is obviously only the first part of the process, and when we go through that development of the strategy, very much putting health at the centre of that, and kind of driving it through that way through the strategy. So again, as I say, it's a live document. We are going to be constantly going back to it to review and refresh, and hopefully put that, you know, make that a thread that goes through into the strategy itself around health being at the focus of this. Is that a question?
Yeah, and for the musculoskeletal conditions programme that's been launched and is available in health hubs, where are those in Thurrock, and how do people access them? Do they get referred through GPs, or can they refer directly? How does that work?
Mark, do you want to answer that one?
Yeah, through the GPs. So it's a referral through the GPs. It's a kind of the previous service was provided by an organisation called Connect. So it was a more kind of distant, remote referral pathway, and I think this report kind of picks up that there was quite a lot of dissatisfaction with the service. It was quite removed from primary care, and there was some long waiting times. So we changed that service probably about 12 months ago, and now it's kind of very much wrapped around primary care, and we have now low waiting times and much higher satisfaction with the service offer.
Thank you. So that would be just people going to their GP, or if their GP surgery has got a you know, another clinical physiotherapist or whatever, can they refer? Presumably they can through our multidisciplinary system. Okay, thank you.
Okay, thank you, councillors. Obviously, our role is to make recommendations with this one and to comment on it. I wouldn't know where to start, to be truthful. There's so many comments have been made regarding this. I think we accept that it's a live document and it's going to be updated as it goes forward. I think we can accept that it is a part of playing the whole strategy. Councillor Holloway.
Yes, sorry, Chair. Appreciate you bringing me in. For me, I appreciate that it's a working document, and Andrea, thank you so much. Bearing in mind you didn't write it, you're a hero. I know this isn't how you write JSNAs, and I know it's not how you write reports, and it goes against anything whoever has been told to write reports writes reports. But I would just bring the Thurrock element to the front. I know we often say, here's the argument, here's Thurrock, setting out everything, and here's how we're going to fix it. But I think it's a lot of the structure around the arguments is upside down, and really just by restructuring a lot of that would really help to kind of present it going forward. I think, as I said, the focus is off. So when producing documents and whatever is produced out of it, from our purposes and definitely residents' purposes, put health first, kind of put the finances at the back of the paper, and I think a lot of that will help. But again, it's not practical, but hopefully that's some way helpful, because I don't think I would have been upset reading it if I'd have read it back to front as opposed to front to back.
Thank you, Councillor. Councillor Rigby.
Thank you, Chair. Yes, I'd just like to say that although some of the wording might come across as unpalatable, I think the basis of what is wanting to be achieved is there. So I think it can be worked on, and I think there is a plan there. There is also reports of how to help people with multiple skeletal issues, like the physiotherapy as well. So it isn't all just about the money and getting them back into work. It could maybe, parts of it could maybe be worded better, but I think the grounding for something to work on is definitely there. So I think there are quite a bit of the right processes going on. So thank you.
Thank you. Mark, do you want to come back in quickly?
Yeah, it was. I think this is a really complex area, and I suppose what I was slightly concerned about when I read it was that there's several references to the services being kind of like siloed and not person-centred and not flexible. And I think particularly with the kind of mental health part of that pathway, I think what we've tried to do is have mental health specialists as part of the clinical services. So they are embedded in IAPT, they're embedded in secondary care, they're embedded in the early intervention in psychosis services, so that they are part of the treatment programme, and therefore do really wrap around the individual and try to do that in a kind of holistic and kind of coordinated way. So I think it's fair to say that services generally are, but I don't recognise that description for the mental health aspect of it. And when I read through the report, there are kind of some quite broad statements that probably need to be a little bit more targeted to the kind of to different areas, because I think as it reads at the moment, I'm not sure that I would agree with some of the conclusions that have been reached, particularly on the mental health side.
Okay. Ian, would you wish to comment on that?
We have had this conversation previously. The document was produced during 2019 and then COVID's happened. So some of the elements are a bit out of date, and I know Andrea is planning to refresh the entire document with some more data. So I think the timing in terms of this is a little unfortunate, but I think we wanted to bring it so that we could then continue with the process rather than start again and refresh everything. But I take your point, and certainly in terms of the new integrated models for mental health at community level, we can probably capture some of that.
Yeah. Okay. Councillor Holloway.
Yeah, I was only going to say, and I'm sure it would be, but anything that I'm sure we would, it goes without saying, but anything that we are talking to employers about this is what we think the kind of employer you should be when employing someone with a disability. speak to some people with disabilities that have is the first thing I would say. You know, ask them what they would have done, and cross a whole range of conditions, physical and mental. So really kind of, I think it's such an opportunity to really delve in and speak to people about the support that they needed, the occupational support, that just everything. I think it's a real opportunity for us to say this is what we think a good workplace is, maybe involving Health Watch in that in some way, shape or form, to kind of get that in and say, but I'm sure you would anyway, but I just wanted it just in case.
It's the smile that gets you at the end, isn't it? What I think we can do is to say our recommendations are that it needs to be readdressed with some of the terminology that's used, the way it's been set out. We don't wish to hold up the process of what is going on, because it's a very live situation, but being that it is set on data that is clearly out of date, it's hard to say that everything's great with the report. So as a committee, what can we agree on? What was some of the members' ideas, what we could recommend? Mark, I see you hiding in the corner.
I'm just wondering whether we can do a kind of quick refresh of the data to kind of bring it up to date as part of that strategy development.
Yeah, obviously they won't go in front of us again till June. Would it need to come back in front of us once it's been readdressed, Councillor Maldani?
I wasn't necessarily answering that question. I would say it needs, well, but if you're going to ask me that question, I would say yes, it should come back to Health Committee when it has been refreshed. Yeah, I think the data needs to be updated. I think maybe there needs to be more consultation with groups that, you know, with actually disabled people, with people with these conditions, but also groups that represent them, perhaps in the work situation, but you know, in terms of health needs as well. And otherwise, I think probably Councillor Holloway's suggestions, which I'm sure she's going to give you now.
Well, I mean, what I do see is I don't wish to ask for more in depth on this, where it's going to impact people with mental health, because I'm aware of other things that we're doing within the council regards to mental health, and there's an overlap. It's going to be a big wide strategy. But I take Councillor Holloway's points on board. It is a thing of maybe having a look at it, readdressing some of the issues that have been raised tonight regarding the data. Councillor Rigby?
I hadn't got my hand up, but
sorry.
that's all right. But yeah, I think I do think that the grounding is there. Obviously, the wording does need to be changed. I know a few people weren't happy with the worklessness term, so some of the wording and the focusing, but the actual groundwork of what we're trying to achieve is there. So I think just work on how to get there better in a better way, probably.
Yeah. Okay, so we're recommending for it to be taken away and come back to us in June, Councillor Holloway?
Yeah, I was just going to say that, I mean, I'm very mindful that a lot of this, I think, probably could be solved with just rejigging and presentation. I would trust officers that I'd like to see it at some point in the next municipal year, but I don't necessarily need to see it in June. And I would trust that they would go away, and as they refreshed, adapted and kind of added bits in, that they would, you know, notify us to the suitable time that it should come back in the year, because I don't mind, I don't need to see a rejigged just the change of the look. I don't mind that so much. So, but I'm sure, you know, Andrea's fed into a lot of the issues, and, you know, the refreshing of the research, the certain groups, the certain things that we need to done that you've been taking notes of. And I'd be very happy for officers to make a judgment call when we should see it next year, if that's helpful.
Can we all agree to that? Yep, a lot of nodding. Brilliant. Okay, so that'll be our recommendation, that officers go away and bring it back to us when they feel it's appropriate. I do appreciate the work that's gone into this. I know, unfortunately, it fell while Andrea was on her maternity leave. So I do thank everyone that's taken their time to put into this report. Okay, and if you think that one was difficult, we've got item 8. Do we have to? Okay, the CCG update of 2019-2020 financial assistance provided to Cambridge and Peterborough STP. The report can be found on pages 111 to 112. Can I ask Mark Tebbs to introduce the report, please? Brace yourself, Mark.
Thank you. Could I introduce Mark Barker? Myself and Mark are going to do a kind of double act on this paper. Mark is the new Chief Finance Officer across the Mid and South Essex Group. So if there are any sort of technical financial kind of questions and queries, then we've got Mark to kind of help support answer those. Obviously, a lot of this work was done for Mark was kind of involved in the Thurrock economy, and obviously Maria Wheeler has now left the system. So if there are any issues we're not able to address or confirm, then we may need to take some of those back as kind of personnel have changed. So the paper kind of sets out and provides an update in relation to the Cambridgeshire and Peterborough loan. We have obviously discussed this on a number of occasions, so I'll keep the kind of update fairly short. But just as a kind of very quick summary, the paper refers back to the period of the 1920 planning round and the issue that Cambridgeshire and Peterborough had in terms of the cost pressures they had within the very sizable cost pressures they had within their system, and the requirement from the region, the kind of NHS regional kind of finance leads, to balance the kind of financial books across that kind of regional footprint. And as a result of that kind of requirement, each CCG in the region were asked to contribute £5 million. And Thurrock's share of that was, as it set out in the paper, 480,000. So in March 2020, so kind of this time last year, the CCG achieved that surplus, and that surplus kind of was a process by which the kind of regional financial books were brought into kind of greater balance. During that period, at the beginning of September, the Director of Strategic Transformation, the Locality Director, Wayne Bartlett-Siri, came and presented to this committee. I think it was one of his first meetings he had in post, actually. And he gave us an update in terms of how the kind of national finances flowed and what the expectations were in terms of balancing the books at kind of that regional and national level. And I think at that time, members expressed kind of concerns about the kind of equity of the kind of situation, so and the fairness of taking resources away from Thurrock residents, and the impact that would have particularly on our local mental health services and the speed of our transformation programme. And I think it's also fair to say at that meeting there was a promise made that that money would be paid back within 3 years. This paper sets out the kind of position that has been agreed with our regional colleagues, that the money has been returned to the system, and that Thurrock patients have benefited from a number of investments over and above the kind of CCG allocations. So there's a kind of on one of the tables it lists kind of 3 kind of headline numbers, but there are a whole host of schemes that kind of sit over and above the allocation process, and therefore the kind of position with the region is that the kind of the money that was taken away from this system has been returned to the system, and that the population of Thurrock have benefited, although not directly to the CCG, kind of like coffers, there have been money that has benefited the Thurrock population. The paper also confirms that the mental health transformations which the committee were concerned about being slowed down have progressed at speed. So the 24/7 crisis service, I think was probably the original point of concern, is now up and running. It's been up and running for a year. We mobilised that during COVID, and now the attention is very much on the expansion of the kind of community-based mental health services, and which is seeing greater investment in perinatal mental health and early intervention services, community mental health, primary care mental health. So I guess some reassurance to the committee that there is more money going into mental health services, and our issue is around workforce and recruitment and spending the money rather than any kind of financial constraints. So I guess I would probably just conclude by saying that I think the promise made, and I'm sure the expectation of the committee was that the money was going to come back to the CCG and that we'd be able to see it in the CCG kind of budgets, and therefore I imagine there will be some disappointment that kind of promise hasn't been kind of fulfilled, but to confirm that there has been additional investment greater than the 480,000 that was taken away from the economy, and it has directly benefited our population. And this is the kind of the position of our kind of regional colleagues. So I think that that's probably all I was going to say in terms of a kind of like an overview and a presentation of the paper. Mark, I don't know whether there's anything that you'd like to add from a kind of to kind of supplement that commentary, or add any more kind of details around the kind of financial NHS allocation process?
Yes, if I may, it might help to understand the context of the paper, because much of the paper is about talking about the 480,000, and of course in section 3.1 of the paper itself, it also outlines the system position for 1920, and starting off with the 1668 million, which sits across the system, and how that has grown to 1697 in the year. To put that into context, that's a £29 million worth of growth in 3 clusters: in-year changes, transformation support, and provider support funding for our system, of which Thurrock is part. Compare that to 2021, albeit a very odd year. We start off with an equivalent 1.7 billion within the system, and we've had additional funding which has come in to support NHS services just short of 52 million, which is nearly double the 29 million which was added last year. In addition to that, we've had another 42 million pounds for the COVID monies, a further 60 million pounds worth of top-up funding, and 8.2 million pounds worth of growth. So the amount of additional investment which has been received in 2021, albeit you can't see 480,000 specifically, has far outweighed the amount of support that we received in 1920. So there's been a massive, significant investment in funding for the NHS in the current year, which has supplemented the services throughout the whole of Mid and South Essex. So it's enabled us to do many of the things which I think have been touched on in other reports, like increased digitisation, support for care homes, dementia support, diabetes with flash glucose monitoring, a whole raft of other initiatives like Bed Bureau, which facilitates quick and efficient discharge of patients into an optimal setting for ongoing care or their continuing needs. And generally speaking, the amount of additional funding that NHSE has provided and Treasury have provided has far outweighed past investments, and of course considerably exceeded the 480,000 element of Thurrock funding which was taken away in 1920, and which was part of £5 million, which was taken away from the system in that year. So happy to take any questions, Chair, or offer any further comments if you require further detail.
Thank you, Mark. Okay, Councillor Muldowney, do you want to go first?
Yes, thank you, Chair. Thank you for this report, Mark. I'm sorry that you're here again taking this. So please don't take any of these comments personally. I'm sorry you've been left carrying the can on this one, but I am going to have to be quite robust on this. There's a few points, and they're not all directed at your colleagues, but can I say at first, thank you for there being a finance person actually here to answer these questions, which is what we asked for at 2 meetings now. So thank you very much for doing that part of it. I'm very grateful for that. First of all, within the committee, we asked the chair at the last 2 meetings to write a letter from the HOS committee. Did that happen? That's my first question. Why haven't we received a copy of it? And, you know, was there any reply? 2, I would have liked a bit more of a full report, but you're here to answer questions, so that's good. I still don't know from this report whether this money has been paid back. It seems like it hasn't been paid back. What you're saying seems to be the position at the last meeting, that because we've had extra money in this last year, which not specifically to Thurrock CCG as we were then, or the footprint of that within the bigger system as we are now, we would have had some benefit from that. Well, I would hope so, that we had extra funding over the last, you know, in this year, because we've been in the middle of a COVID pandemic. You know, obviously, and the government promised that they were going to give us the funding that we needed, the NHS, the funding they needed in order to cope with that. So, yes, I would hope so. However, I presume that whatever system, and by system, I just need to clarify, are we talking about Mid and South Essex Trust here? Is that what you mean about system? As opposed to region, which would include Petersburg and Cambridgeshire, I presume. I presume that Petersburg and Cambridgeshire, whatever system they're in, has also received extra money this year. Now, we're still in a position where we have got much inferior services, especially if we're looking at mental health and the services in Petersburg and Cambridgeshire. We still had a delay of those services by handing over this money. Mark's absolutely right in saying that we had Wayne Siri Bartlett here, and he promised us that it was a loan and it would be paid back to us within 3 years. That doesn't seem to have happened. Yes, we've had extra money into the system, but we've been in the middle of a pandemic. We should have had extra money into the system in order to cope with that. I can't see from here, from sort of these figures, what any of this money was for. Was it all COVID? Were there extra things that we got that other parts of the system didn't get to compensate from it? Even if we've had more money, we still want that back from Petersburg and Cambridgeshire. I mean, we've just seen that. No, I haven't
Mark
finished.
wants to come back in.
Yeah, but I just want to finish, please, if you'll let me finish. Just let me get it out of my system. We've just seen from the budget that next year the NHS budget is going to be reduced, you know, at a time when you've got a backlog of surgeries to do, when you've got rising mental health problems. We need every penny that we can get for our local residents. For me, this is not good enough. And I'd like to know, I understand from your level, Mark, and probably from a finance level, you've done what you can. I think it comes back to the committee. And Chair, I need to know, what are you going to do about this now? Are you just going to roll over and just forget about this money? Or are you actually going to take it to the next level up? Are you going to write to some people? Are you actually going to take action? I think, quite frankly, you and the portfolio holder, who have both promised me that you would pursue this money, need to pull your finger out and get on with the job. Thank you.
Okay, thank you for those comments. Before I comment any further, I'll be bringing in Mark. Thank you.
Thank you, Chair. I think I can answer some of those questions. I may need my counterpart, Mark, help on one or two. Have we received back the 480,000? I can't say for certain. What I can say for certain is that there's significantly more money coming to the system than was previously lost, and significantly more than in 1920. Now, the 1920 figures that you have before you in the paper is not a COVID year. 2021 is the COVID year. And in 2021, we've received an extra 42 million into the system to support COVID expenditure. On top of that, another 52 million for other initiatives, and another 60 million top-up funding, and another £8 million worth of growth. So significantly greater than the 29 million, which is referred to in the paper. So I can't pinpoint 480,000, but I can pinpoint many figures which are in excess of 480,000, which even if we lobby NHSE for, can we have the 480,000 back, please? Then it may well be that their answer is, we've already received it and more in kind from the investments which have been given back. In relation to those monies, out of that, at least 9.2 million has come into Thurrock CCG itself, which in itself would be a third of what was received in 1920, which is to one of 5 CCGs within the system. In terms of I think they're probably the 2 finance elements that I can actually answer your question, Councillor, and possibly ask Mark in terms of progress on discussions with NHSE.
Yeah, so just to confirm, I did receive a letter from the chair asking me to produce the report and to have a finance colleague in attendance today. So that's what we've done. And just to kind of reiterate Mark's point, really, you know, I think that people left that previous HOS meeting thinking that it would be returned badged Cambridgeshire and Peterborough 480,000 Thurrock CCG, and I think what has happened is that it has been returned to the system in to a much greater extent, so much more than the 480,000. But I don't think you will get something that is badged on a spreadsheet with the Cambridge and Peterborough label against it. I think what you've got is both greater investment in that actual year, so the 1920, and in addition now in 2021. So yeah, so they were my 2 points, Chair.
Thank you for your answers, and thank you again for being here to, you know, having a finance person here to answer those questions. Still, let me ask this then: has any of this money actually come from Peterborough or Cambridgeshire?
No, it doesn't come from Peterborough and Cambridgeshire, and likewise we wouldn't have made payment to Cambridge and Peterborough. The monies are redirected back to NHSE, and then NHSE make an allocation to Cambridge and Peterborough, and likewise we receive all our funding from NHSE. So you cannot see the third party in the transactions.
Right, but presumably, well, do we know if Cambridgeshire and this transformation support, was this money for the transformation into the bigger trust? What was that money actually for? Do we know that?
It's a variety of transformation initiatives which will cover everything from digitisation to investment in secondary care, community health, and also primary care. I don't have the full breakdown of the 1920. We can provide that if it's helpful, but it will be, I would say there'd be at least 30 or 40 elements to it, because we can receive allocations every month, and some months 10 or 12 at a time.
So were we the only system that received extra money in this year, 2019 to 20?
No, every system will have received some allocations.
Well, exactly. So the Peterborough and Cambridgeshire system would have received extra money. So we still need this money to be repaid. That's my position on that. I'll let other people speak, though. I've said my piece.
Thank you, Councillor. Just coming in quickly, apart from writing the letter that we said we would do with the portfolio holder, we also emailed Anthony McKeever, and basically we've got a very short answer. Are we going to get the money back? The answer was no. Very to the point. Again, as explained, the funding has come in, which they view as gone over what they were spent. The question has been raised is that obviously Peterborough and Cambridge managed to have a platinum mental health service, while we were somewhat delayed with our rollout of our mental health services. The promises were made that it was going to be paid back. That is why it doesn't sit well with us, any money being taken off. But more importantly, our budget was set. And this decision was taken after our budget had been set. Just going to bring in Councillor Holloway.
Thank you, Chair, and appreciate, obviously I echo everything that Councillor Muldowney says, because it's 100% correct. Before I get into anything at all, what does system mean?
System means the commissioners and providers within Mid and South Essex. So it comprises the 5 CCGs, Mid, Basildon, Thurrock, CPR and Southend. And it also combines the 2 providers which are part of our system, which is Mid and South Essex Foundation Trust and EPUT.
Great, thank you. I will say, similar to Sarah, but I just again want to say it myself, Mark, Tebbs, because it's confusing now you're both Mark, you've done that to throw us off, but Tebbs, I just want to say thank you again for really, you have brought this back, you have been the one that's kind of been having to kind of deal with us committee after committee, and I'm sure you want the money just as much as we can. Mark Barker, again, echo Councillor Muldowney, thank you for coming. We really have appreciated it. It seems like you're new in post, so this probably has been landed on your desk as it was landed on Wayne Bartlett's series when he rocked up to a meeting and he hadn't been in the job long. So look, I'm really mindful of that. That said, this is just not acceptable. It's absolutely not. I thought us politicians were supposed to be the ones that did the spinning and all of the kind of, the messaging all around it, not the NHS, but that's essentially what we've got. And I'm really mindful that it's funny that we talk about a systems approach until it comes to a CCG over here doesn't have money. So it's a systems approach when we've got a load of money, but then it's an individual, these people haven't paid theirs, so we're going to take it from you when there's no money. Let's be honest, it's utter rubbish. It's just utter nonsense. We're getting, look over here, you've been given loads of money. We have no idea, what Thurrock are getting. What we absolutely do know, as Councillor Ralph said, as Councillor Muldowney said, is that Cambridge and Peterborough CCG are still better off. And I know how it works and the pots and It's a point of principle now. I mean, I'm smiling and I appear to be laughing. It's not funny. It's not funny. I'm almost hysterical at this point because it's gone on for so long. It's not okay. It's not acceptable. It's not. Look over here. We've given you loads more there. It's not right. It's not right. We know it's not right. I know that budget doesn't come back and have, Cambridge and Peterborough, we owe you. But that they are running not just a platinum health service, a health service that's platinum across the board. And we're not. And we don't want to let it go because it's not fair. We are being treated, Thurrock CCG, you say we managed a surplus, we manage our budget, we've said it before, it's not acceptable. And we are saying, you're going to do it again because apparently this is an acceptable way. We're trying to go up at NHS systems to get the money back at Thurrock CCG level, not, your whole system across Mid and South Essex are doing better. Where Thurrock councillors, the money was taken from Thurrock, put into the pot, we want it back. I don't think we can be any clearer.
Thank you, Councillor. I'm not too sure what the question was. I don't think there was one. I think it was.
Can you give us our money back, please?
It's not my gift, Councillor. But what we have done is we have lobbied long and hard to suggest that it's not appropriate to take money away from our system and not return it. The responses that we've received is you've had it returned in kind with oodles on top. And as a consequence, it's a little hard to continue that pushing water uphill approach, which is to try and receive the IOU back from Cambridge and Peterborough. It doesn't come that way to us. So It's not that we've given up the ghost. We haven't. We continue to lobby for further monies to come back to us. It's about whether or not we can realistically achieve that. And if it was within my gift, of course. And I totally agree that taking monies away from our system and our CCGs is not appropriate. And that's not something we would countenance. But to be able to receive it back when somebody else has got it, when you've already been told that you've already received it, is somewhat more difficult to actually balance the argument.
Thank you, Mark. I think that's sort of one of the best explanations we're going to receive. I do think that we could keep bringing this back to HOSC every time we meet. I don't foresee us getting a different answer. And it is like banging our head against the brick wall. They are convinced that they have put it back in kind to us. We know we was made a promise. We were expecting it to come to us. A surplus was orchestrated in our CCG to cover that, which I'm unhappy about. I'm unhappy that Peterborough and they have a platinum service. Platinum, it's just ridiculous. I'm unhappy that it was done once our budget was set, that we'd already planned for that money. Would I accept an apology from them? Well, if we're going to keep banging our heads against the wall every time we meet at HOSC because we're asking for this money back and it's not going to come back, as McKeever said, it's not going to come back. It puts us in a very, very difficult situation. I know that it's been minuted and it's been live streamed, but the term of bending it over and taking it comes to mind. And I don't think we should. But that's the problem. And I think our voices can be loud, very loud and very clear on this. No more louder than Councillor Holloway's. And very passionately put. Thank you. We don't accept it. Are we going to be forced to accept it? Probably. And that's unfortunately the reality of it. And it still doesn't sit well with me. I think that as members of HOSC, we need to maybe talk together over this without other people on board, and we can decide if we are happy to put it behind that some people can't ever be trusted when they make a promise. I do appreciate it was the guy's first day in the job, and perhaps he should have been briefed a bit better before he turned up. I think I've gone on enough. I'm going to bring Councillor Retzel in.
Thank you, Chair. I don't. Yeah, it probably is. We're banging our heads against a brick wall, aren't we? Really, but if you give money, you expect it back, and I think it might not be a lot of money in the realms of thing as what we've got back, but it's still money that has gone, and we should get it back. And I thought this was an overview and scrutiny, and we should be scrutinising what we've given to get back. So I can't really put it any more than it is. So I think, you know, we have got to keep banging, because if you just let it go, it could happen again, couldn't it? What would happen if we hadn't have give the money? You know, so it's got to be, as the old saying goes, it's not quite gentlemanly, is it? You know, if you're going to give money, you expect it back. If I was to lend Councillor Victoria Holloway some money, she'd expect it back. So I think that we still got to bang on. It is an overview and scrutiny meeting, and we scrutinise. That's what we're here for.
Yeah.
Thank you.
I think the term you was looking for, it's not cricket. It's
that as well, Chair. Yeah.
Yeah. It is, I think. I do think as a committee, we will write to you again, as all of us will, in a joint letter stating what we wish to proceed through. First of all, Councillor Mardani.
Yes, I mean, I don't need to go away and have another meeting off channel. I don't accept it, and I think that maybe Mark, who I'm so sorry that you've just walked into this job and this horrible situation. I do feel for you personally, and I do feel for Mark personally, who's had to carry the can on this. I think maybe they've done all they can at their level. Maybe Mac has done all he can at his level, and we need to think about going to the next level up.
Chair. Sorry,
Mark. Go on.
I suppose really it's for the committee to decide how best to proceed. My recommendation is that we lobby for additional monies wherever we can, and we have the relationship with NHSE to secure additional funding. And we've continued to do that very successfully in the current financial year. Despite COVID, on top of COVID, we've received additional sums. I take Councillor's comments earlier. I am new to this part of the system. I have been in South East Essex for a couple of years, so I've suffered the same pain that Thurrock have suffered, with monies being clawed away from Southend, from Castle Point and Rochford, and from the other CCGs. So I feel your pain, I feel your anguish, and we have continued to debate it at governing body and also in our respective committees elsewhere. What we have found is that we're getting very little traction on anything coming back to us which has that label of a repayment exactly to the value from Cambridge and Peterborough, but we do keep getting pushed additional monies our way. What we have identified is that it may be better to improve the relationships we have, continue to lobby for additional funding and secure that where we can, because we've been very successful in the last 18 months in doing that, and that relationship is well built and well founded. My fear about continuing to lobby for a particular sum is that we may damage that relationship and therefore unsettle improvements to funding which are coming our way in droves. And it's clearly it's the call of the committee as to how you'd like to proceed, but my concern is we might do ourselves more damage to funding that's coming into the system rather than solve a problem that you've eloquently outlaid to me.
Thank you, Mark. I am aware that obviously when we look at saving Southend, I think it was 250,000 that was taken from the Southend CCG or something like that.
That's 610,000 Chair from Southend and 579,000 from Castle Point and Rochford.
Right, okay, so I know that going back over the minutes, it goes to a people's panel within Southend, isn't it? It's not had this is run here, so people didn't get a chance to really voice their opinion on it. This is our HOSC, and when we're not happy, as you can clearly see, it is that point of we have no guarantee this is going to happen again. And I know when I say that, I'm pointing to the fact that all these CCGs are going to merge and it's all going to be one happy family. There'll be no accountability on how this still spread, that we're going to get our fair share and all this. I want not a guarantee this, not going to keep happening. But when someone is getting clear benefit that all other councils are supporting their health service and it's the best health service there is, it hurts. You know, it hurts us. It's not good. It isn't good. And no, I don't want to keep harping on. I don't know who was next, Councillor Muldowney or Councillor Holloway, sorry. Councillor Holloway.
Thank you, Chair. And again, yeah, really appreciate your reply, Mark. You know, however, again, it's not good enough. You can't just shrug your shoulders and go, "Oh, that's the broken system we're working within. That's just the way it is." We don't work like that. We don't work, you know, like that. But yes, it is a broken system. It doesn't work. If I thought that we had enough power as a Thurrock HOSC to derail something, then I think we'd probably have the same power to kind of get the funds back. Okay, then can I just make a suggestion instead? The money has gone into the system. The money went into the system when it was taken last year before last. Don't even know what year I'm in now. The money went into the system and then out, and now it's come into the system and there it is. We won't mention 400,000, but can we just let's just round it up. Let's call it an even 500k from the system back into Thurrock CCG, And then we're not asking for money outside of the system. It's gone into the system and it's gone back in, and now we're just asking for it transferred back. I promise to never mention £480,000 again. We'll call it an even 500 and we'll all go home.
Thank you, Councillor. Thurrock has received 9.2 million, so it could well be part of that 9.2 million.
It might not have been, you know, yeah, I think we're going to go round in circles. I'm mindful that I don't want it to keep coming back to HOSC, and I think actually having Mark here has helped that. I definitely don't think, I think I am happy to take it offline to kind of take it forward, because I don't want to spend any more time talking about it at this meeting this evening. But the responses are not. The responses aren't okay. The system isn't okay. We will not be treated this way. If we give up now, it will happen again, because it's only more financial difficulties. We know nationally that the government aren't investing as much as they were in the NHS. It's going to get worse before it gets better. I'm unfortunately really understand your points, but no is the answer. We're not going to just accept it. But in the meantime, if you want to take it back, my suggestion with regards to the 500,000 from the system back into our system, that would be great.
I think the argument would be, Councillor, that they have done that, but they can't evidence it.
Well, no, they haven't. They've put it back into the Mid and South Essex, but they've not put it back into Thurrock.
They
haven't. Yes, the
no,
9.2 million, but
9.2 million is back into Thurrock.
That was this year. What was the year before? What did we get?
I don't know, Chair.
Probably less because there was COVID payments.
No, COVID payments is the current financial year. The previous year was pre-COVID. So the 29.4 million, I've only got it at system level in the table that's in the pack. I can break that down by CCG.
The numbers don't add up, so we shall go forward. But yes, Chair, I don't think we should bring it back to HOSC again. No, not the next meeting anyway, maybe another time.
I do think it's something that, in one way drawing a line under it, but also making that statement that we're not happy with it. It shouldn't have happened. And if there's a way we can evidence it coming back into us, we'd be more than happy. Councillors, I will contact you online via email regarding this. I do appreciate both of you coming tonight and weathering what you've just gone through. It's we've had many meetings over the last few weeks regarding this, and I think that there was never going to be an answer that we were going to be happy with. If you turned up tonight with a cheque for 480,000, I think that would have made everyone laugh and smile. But
I would have been happy with that, Chair. I would have been happy.
Yeah, I think you would have done. But that said, I think we will draw 900 for tonight and for HOSC, and we'll move on to the next part of the agenda. Sorry, Councillor Mondani, I did see you had your hand up. I've just seen it. Did you want to say anything quickly?
It's okay. I mean, I had a similar idea to Councillor Holloway, that if this has been in the system, then can we start writing a wish list for, I was going to say 480, but no, I like the idea of 500,000 for us to spend in our footprint here in Thurrock. That would be good. Thank you.
As I say, Mark, we do accept cheque, and you can also pay by backs. So, okay, item 9. Thank you. If you want to stay on the next one, so I think they're quite important with the COVID update. So, COVID update. I would like to welcome Jo Broadbent to the meeting and ask her to introduce her update. Thank you, Jo.
Thank you, Chair. I'd like to share some slides with the committee, if that's all right with you. But before I do, I just wanted to say hello and introduce myself to those members of the committee that I haven't met. Hi, my name's Jo Broadbent. I've recently joined Thurrock as the Interim Director of Public Health, and I'm picking up the public health responsibilities that Ian Wake used to have. So it's a pleasure to meet you all. I am just going to try and share my screen. Oh. Has that worked?
Not yet.
No, that doesn't look right. Hold on. Oh.
There we go.
Ah, okay, good. Good. Okay, thank you. So before I get on to the current data, I just want to go back to the minutes of the last meeting, which was less than 2 months ago, and just remind ourselves that at that meeting, Ian updated the committee that the COVID rate, the 7-day rolling average COVID rate then, was 1,334.7 cases per 100,000 people, and that we had a positivity rate in Thurrock of 22%. And like I say, that was less than 2 months ago. So looking now, this slide is showing us the current data, and this is the rate we have now, which is 98.1 cases per 100,000 population, which is obviously a substantial reduction from where Thurrock was less than 2 months ago. You can see here this graph, we are still at a higher case rate than most of our nearest neighbours, and that is something that we are aware of and need to work on. This is the epidemic curve. You can see the sharp increases over Christmas and New Year, and then the substantial decline that we've had since then. We had a bit of a blip last week where we had a slight increase in cases, but that seems to be going down again, and the downward trend seems to be continuing. This is the latest age breakdown of the current cases, well, within this week, which is the latest data we've got. And you can see, and also going back actually to the minutes of the last meeting, it was reported that the highest numbers of cases were in adults aged 22 to 59, and we're still seeing that pattern now. We're still seeing high numbers of cases within the working age adult population, or the highest, should I say. Also of note on here, you'll see we now have quite low case numbers in the over 70s, and there was a report published this week from Public Health England looking at the effectiveness of the vaccine programme, which showed that the vaccine has been 80% effective in reducing hospitalisation among our older residents that have had the vaccination, and between, I think, 57 and 73% effective in reducing symptoms of COVID. So it's not 100% effective, but it is having an impact, and we are seeing now low case numbers within the over 70s. This graph here looks very busy and very complicated, but there's two things to note here. The lines on the left are males, and the lines on the right are females, and this shows the numbers of people taking up our testing offer for asymptomatic testing. So these are people without symptoms, and we can see a couple of things on this graph. Firstly, historically over the past sort of couple of months, we've had much higher take up among women than men. But I also want to bring to your attention here these black bars in the most latest data. So the black bars represent those aged 10 to 19, so our secondary age pupils essentially, and we've offered our secondary pupils all a COVID test, an asymptomatic COVID test, in the week before they went back to school, and we can see here that quite a number of the families are taking up that test, so that's very positive. This shows the numbers of our asymptomatic and symptomatic tests that come back positive and negative. And you can see that particularly for the asymptomatic tests, it's a very thin sliver, a very small proportion that come back positive, only 1%. However, that is 455 cases that we otherwise wouldn't have identified. And actually, it's around a third, and has been for some time, around a third of the cases that we're identifying are coming from this asymptomatic screening that we've been offering in Thurrock. So it does show the importance of continuing our policy there, as well as this symptomatic screening. This graph shows bed occupancy and those who are receiving oxygen therapy and ventilation within BTUH. And you can see that again, since early January, the numbers have fallen, although fallen more gently, not as sharply as case numbers have. And you can see maybe just in the past week or so, we are perhaps getting a bit of a levelling off of these numbers, but it's very welcome that we're now got many fewer people being hospitalised with COVID. But it does indicate that the NHS system is still under pressure from COVID, and that pressure hasn't completely gone away. So the current situation, we have now the geographical spread of cases within the borough is reducing, and that's very welcome. We have one school currently in a recovery outbreak, and we have 3 care homes with a live outbreak. But considering where the position with care homes not that long ago, that is an improvement, and we continue to work with and support those care homes. I mentioned the geographical spread. You can see there's lots of white areas on this map, and the white areas on this map represent areas with unique postcodes where there are no infections, and we now have 11 local areas where there are no localised infections. I'm just going to take you sort of back in time to the 14th of January, and this picture will change. The blue and the depth of the blue colour indicates the number of cases. So pale blue is 1 to 9 cases. Darker blue is much greater than that. So if I just take you back through time, you'll see the number of the white areas disappearing, more of these dark blue areas, and that's where we were back several weeks ago. And so you can see that really that geographical spread has got much better recently. I just wanted to just talk about 2 other issues quickly. Firstly, vaccination. So as we know, the vaccination programme is underway, and Mark and our CCG colleagues are working very closely with us on this. This slide here is just a screenshot of the data that is now being published nationally about uptake in each CCG. So I've highlighted Thurrock CCG. Sorry, this will be very small, but I will put in the chat the link to this website so that you can check this for yourselves. And the data is updated weekly now, and this gives you the numbers of vaccinations of under 65s and over 65s, first and second doses that have been given in each CCG. And just to try and interpret those numbers a little bit for you, we know that of the over 70s now, we have over 90% of all our over 70s have been given the first dose of the vaccination, and it's about 85% of our 65 to 69-year-olds. And this compares very well with the rates across the country. In terms of percentage, that's slightly higher than we see for England and also for the east of England. So I think our NHS colleagues are doing a good job here on rolling out the vaccine. There's more work to do, and but we are in a good position, and I'll share the link for this data so that you can look at it for yourself. The other thing I'm going to have to come out of my presentation just to show you the other thing. Can I do this? I wanted to show you this map. So obviously, as well as vaccination, one of the other key interventions that we've got is testing, and I've already mentioned testing. And I just wanted to show you these are the locations of the testing sites that we've got within Thurrock, and we've got 3 new sites that are opening over this weekend. And those are a site in South Ockendon, which will be opening on Friday. We've got another site over here in Corringham, which will be giving out lateral flow device tests over here, and that's opening on Friday. And then on Monday we've got another site down here in Tilbury that will also be giving out lateral flow device tests. So I just wanted to show the committee that this is where the testing sites are, and we're now starting to get much better coverage across the borough, and we'll continue to work on that. So in summary, if I can go back to my other slides. So in summary, our overall rate of positive tests continues to decrease, and our test positivity is now below 100 per 100,000. And it's maybe helpful just to point out the last time our rates were that low was on the 22nd of October last year. We've still got good uptake of testing, which is encouraging and will help us to manage the pandemic. Hospital bed usage is continuing to decrease, and occupancy now below 80 beds. ITU bed usage is also decreasing slower. The vaccine programme continues to be rolled out, and there's been quite a few changes to testing over the past 2 weeks with children going back to school. We know that there's the in-school testing being offered for secondary school pupils. There is the family and childcare bubble testing that's being offered to all adults in families or childcare bubbles with children in school. And we continue in Thurrock to target those who can't work at home. And particularly important is targeting those younger working age males who've perhaps got slightly lower uptake of testing. Thank you, Chair.
Thank you. That's brilliant. Just wait while you finish sharing your screen. Fantastic. Thank you for that. As I say, we were lucky enough, I did get to see that presentation earlier today as well. It is encouraging that our numbers are coming down, definitely. What I would say, we spoke earlier regarding the amount of testing that we're doing to the positive cases. So where we do look at, sometimes we have a little spike within Thurrock. I think it's important to still note that we are doing mass testing within Thurrock. So sometimes you may hear our numbers gone up a little bit, but that's because we are covering all our bases when we're doing the testing. So I'm pleased to see that we are now getting white spaces on the map. Also pleased that we're getting more local testing sites coming in. I do feel partly responsible for Ian moving jobs and Roger leaving because they've probably seen me enough over the last few weeks. But I'm going to bring in Councillor Holloway.
Thank you, Chair. And I can almost guarantee that my next question will be the reason why the vaccine data hasn't been shared sooner. Joe, would you mind putting up the slide of vaccine data again? Because I only got 2 figures, and there's still a hangover from the last agenda item. I just wanted to double check that I'd got the figures correct, that we have had 35,000 residents vaccinated. And Cambridge and Peterborough have had over 235,000 people receive the vaccine. I just wanted to check in the East of England figures in our system. Are we the least? We've got the least amount of people that have received the vaccine. Is that right? I'm trying not to get too close to the camera now. Am I correct in that?
Small. So this is quite small. I think the reason I brought in the percentages is because Cambridgeshire and Peterborough CCG cover the entirety of Cambridgeshire and the entirety of Peterborough. So it's a much bigger population than the population of Thurrock. So the only way to really compare effectively is to look at percentages. So we are doing quite well in terms of the percentages of the first 4 cohorts to be vaccinated. As I said, over 70s, we're about 93% now, 85% of our 65 to 69-year-olds, and we're working through the other cohorts as well. And those percentages are slightly higher than the average for England. So the numbers don't tell you a great deal. The percentages tell you a lot more.
I'm reassured. Thank you so much.
Thank you, Councillor. Believe me, there's probably no one who hasn't been battering Ian and Roger and Mark over the last few weeks for numbers than I have. I think they've been trying to mute me on Teams recently over it, but it is that thing. When it comes to vaccinations, of course, we don't know how many people in, say, over 80s in that area compared to other areas. So we could do 99% of all our old age pensioners, but they could only be, we might only have 20 people that are that age, where another county could have sort of like 4,000 of them. So it's done. Working on percentages is much better.
Absolutely, and I wish I could read all of the data, because obviously there's questions and concerns. But if Ian says we're fine and Joe says we're fine and colleagues say that we're on track and we're doing well and we're okay, then I trust that.
Brilliant, thank you. Councillor Muldowney.
Thanks, Chair. Thanks, Joe, and welcome. It's nice to meet you and be introduced to you. Thank you for that presentation. Last meeting, when we talked about the factors, because obviously last meeting we'd gone through a period where we'd had very low cases and then there was the big rise because of the variant. And we talked about the other thing that was driving our numbers of cases was the schools being back. So obviously we're going into a period now from Monday where all the schools are going back together, and everything I read keeps saying that that's going to stick the R rate back over 1. In terms of what I understand from the figures is that we are not back down to, you know, if we're only back down to levels of October the 22nd, well, that's still quite high case numbers. Are we going to end up going into a third wave before we've got over the second wave properly? Asking for myself as having a school-age child, but also a lot of other worried parents, and you know, population in general, lots of families obviously in Thurrock.
I think that's a really good question, because as you know, think what happened in October, the rates went up, didn't they? And so I think that there's a number of things to say to that. Firstly, the roadmap to come out of lockdown has been set out with dates, but there are checks between those dates, and I think we need to be continuing as we are in the council and with partners, just really stressing to our community that we need to keep on with the social distancing, we need to keep up with the infection prevention and control measures, because if we don't, we do risk that number, going up again. So I think your point is very, very well made. We're not out of the woods yet. I would also say though that schools have been open. They haven't been fully open for all pupils, but they have been open for key worker families and for vulnerable children. So there have been children in school, and we've still seen the R rate go down. So that's one thing to remember. We do have the testing programme for both secondary children and for the family bubbles, which we will need to promote and we'll need to keep an eye on, but hopefully that will be helpful as well. So I think the point is very well made, but yeah, we're not out of the woods yet.
I think the other thing for me as well was, you know, I totally understand that we, you know, in Thurrock Council and in the NHS, we haven't got, it's not within our gift to close schools down or whatever. So we saw at the last time that maybe they had to close the schools a bit earlier. That might have been a good idea, but I'm just wondering, are there any channels now, are there better channels now that we can feed back what's happening on the ground here into the data that is being analysed centrally, so that maybe some quicker decisions are made? Because we had sort of this struggle between the government last time, you know, going to take schools to court because they were going, look, we've got to close down because this is getting ridiculous. We haven't got any staff and the, you know, kids are sick, etc. Well, not the kids being sick so much, but there's such high level of cases. Are those systems of communication any better? That would be a reassuring point. And is there anything else that we can do locally? I know obviously we've got the testing, but that's going to be lateral flow testing, as I understand it. So less accurate than I keep forgetting the acronym. Is it PCR or is it PRN?
Yes, very good.
It's PCR, yep. Right?
Yes. Very good. The polymerase chain reaction. Yeah, no, I think also very good question. So taking your second question first, in Thurrock, we are going over and above what the national position is. So as you say, we've been offering PCR testing because it is more accurate and because it gives you a diagnostic result. So what we've done, we've written to all schools and all parents offering a PCR test to all children in the week before they go back to school. So that's why we saw, you know, those black bars that were increasing on that graph, so that we can see that already some of the families are taking up that PCR testing in advance of going back to school. And what that hopefully means is that we get an accurate positive diagnosis for any children who are COVID positive, and then they won't be going back into school, sharing it with their school bubble, which then might end up having to isolate the whole bubble. So we are going over and above in Thurrock. In terms of the information flows, so I think that Ian previous to me and myself now have used the really good communication that our education colleagues have with schools, and have really had a really good dialogue. I know that the heads have really appreciated the support that they've had from the council in Thurrock. So we are regularly going to talk to the school heads and you know, hear how things are from them and get that story from the ground. In terms of feeding that up, we've got a number of routes we can use. We can feed up through Public Health England. There's the regional schools convener. You know, there are various routes we can use if we do get concerned about what we're hearing, and we really need to feed that on.
Brilliant, thank you. And my final question is, are there going to be any extra measures in schools different from the last time they were all back in, that are extra? Say, are they going to be safer? Are there measures that can be put in place? Are they being put in place? I haven't heard an awful lot about how we actually make the school setting safer.
So we have, like I say, we've written to schools and parents, but to schools to remind them of how, you know, the guidance on creating a COVID safe environment, and that is the same as it was before. That's not really changed. I think what has changed now is the regular testing. So there's going to be the 3 tests in school for secondary school pupils in the first week back, and then the twice weekly testing thereafter, and the family and bubble testing. And although these are lateral flow tests, so they're not as sensitive as the PCR test, you know, it's that or nothing. So we weren't testing before. So we will identify some cases that we wouldn't have done through the lateral flow testing, I think, and hopefully we'll also identify families and bubbles where there are cases, so that the children could not come into school and can self-isolate and instead of spreading it into the school. So that is a change, and I think we'll just have to monitor and see how that works.
Okay, thank you very much, Joe.
Thank you, Councillor. I do apologise, my internet drops out halfway through that, but I managed to get back in quickly. Just come up to a point that was raised by Health Watch earlier today. Vaccination centres. I know there's concern, obviously, with the Purfleet and Ockenden side. I know Kim was bringing out the problems with transport. Would you like to add anything to that side of the progress that would be made?
Chair, can I, Nigel Leonard, who is the SRO for EPUT, who leads on the vaccination programme, has been dying to speak all meeting, I'm sure, is most probably the best person to answer that question.
Thank you, Nigel.
Okay, thank you, Roger. Thank you, Chair. Hello, it's nice to see colleagues again. As I say, my name is Nigel Leonard. I've got the SRO for the vaccination centres. Obviously, our vaccination centre at Thurrock is particularly busy. I think it's important that colleagues also recognise that the Acute Trust, the MSC group, have also been administrating vaccines, not only from Basildon, but also from Allsit. We also have PCNs delivering the vaccine, and very shortly there will be pharmacists also coming online. They are going through the approval process with the NHS England literally during the course of this week, and some of those will come online. We are hopeful that certainly some of the pharmacists will pick up some of the localities within Thurrock. Whilst the Thurrock Vaccination Centre and also Allsit have been extremely busy in the days that they've been operational, what is pleasing to note is that we have been informed that there will be a significant increase in the volume of vaccine that is available. Thurrock to date has received slightly more than its share. Again, it's worked out on the population basis. And has therefore been receiving slightly more vaccine than other parts of the rest of the system. Certainly what we will be doing now, particularly now we've got the opportunity for the extra vaccine, is not only looking at how we increase the throughput for our existing sites, but also working with Roger and officers, the Borough Council, together with colleagues in the CCG, looking at ways in which we can move towards pop-up clinics in those harder to reach areas, which will start to pick up areas like Purfleet, like Ockenden particularly. We are very cognizant that with the PCN and the vaccination centre, it's more towards the east of the borough, and so that is one of the things that we are definitely looking at. We also are potentially considering, and we have to wait for national approval, a potential drive-through model that may be appropriate for some localities also within Thurrock. So I think over the coming weeks, you will start to see some changes in the way that the vaccination service is delivered. There will be more opportunities in the way it will be delivered. We're just waiting on some of those trials to be agreed on a national basis. We also have an inequalities plan. Kim is absolutely right. It's really important, particularly for Thurrock, that we notice that, you know, it's a very difficult borough in some senses, particularly for hard to reach groups and those on low incomes to travel across the borough to these areas. So this is an area that we've really got to target. Although we are now in a position that we are moving rapidly through the cohorts, we're now currently at cohort 7, as you heard from Joe. Sorry,
Nigel, just going to pause you. I'd like to move a motion without notice to suspend council procedure rule 11.1 to allow the meeting to continue beyond the 2.5-hour time limit. Do you agree to that? Yeah. Great. Thank you, Nigel. Please continue.
Okay. Thank you, Chair. I should try and be brief as I can to allow some questions. So we're now down to cohort 7, which is all those 60 years and over. It is now intended that over the next couple of weeks, particularly, the centre would like us to revisit, together with CCG and PCN colleagues, particularly, as well as the Borough Council as well, to revisit and make sure that we've given and maximised the opportunity for cohorts 1 to 4 in particular, to ensure that we have covered off and offered the vaccine to as many people as possible. I think one of the things to pick out is that, and Thurrock is not untypical of what is happening across the region and also nationally, is we have to target those harder to reach groups, and particularly our BAME community. And there is much work to do. We have developed an equalities plan, and together with colleagues within the borough, and that is one thing that we're looking to target for specific and put on specific events to reach those communities. It may well be we have to be flexible in the way we do that, because the way those communities operate is not necessarily, you know, in 100% in line with the cohort definitions, and that's one of the things that we're currently discussing with region. Because if you take the Muslim community, for example, it will be easy to target their complete family group and get the coverage that way, rather than just offering it by age. And that's one of the things that we're also considering, because it's very important, because the uptake, both regionally but also within the borough, is quite low for those population areas. I'll pause there, Chair.
Thank you. From having personal experience of going to get my vaccine last week, just thank you to everyone that is involved in this vaccine rollout. All the people involved and the volunteers involved, you know, are doing an extremely good job. Very polite and great sense of humour as well, I'd like to add as well. I just want to bring Kim James in.
Thank you, Chair. I just really wanted to ask around some of the things that we're getting back through Health Watcher around the housebound, that we seem to have a lot of people contacting us saying that, you know, their mums, their dads, their aunts, their uncles haven't been reached yet, and what is the process for that, and should they be phoning someone, or are they on a list? So there's that sort of conversation going on. And also the other bit is around the informal carers. A lot of people that look after people who are already being vaccinated are not being picked up, and I know that some of the vaccine centres, the two that we've got, the two primary care ones, are saying that they try and catch them when they come in and sort of try and figure out whether they're just a neighbour that's brought someone or someone that's actually looking after them. And what does that mean? Because obviously they've got people who are just doing a bit of shopping for the lady down the road who are then saying, well, you know, I'm a carer, I do their shopping, but they're not actually a carer. So obviously there's a lot of issues around that. And I know that speaking to some of the GPs at one of the meetings, they were saying that there is actually something in place that's telling them, you know, whether or not this person is, whether they're registered yet or not. So, you know, they need to be registered first to become the informal carer. So I think it's just something we need to bear in mind. I know it's being picked up, but we're losing people in that space as well.
Nigel, can I just bring in Roger for him to make his point?
I'll deal with the carers one, and then Nigel might want to deal with the first point. They are part of what's called cohort 6 that we're working our way through at the moment. Carers numbers, as Kim will know, I think in the last census were quite large in Thurrock. I think it was around 16,000. There's 4 separate groups. So there's people who are receiving carers allowance. So they have been all written to by the NHS England. There are the carers who are registered on GP registers. There's also then carers who have had a carers assessment by the local authority. That doesn't pick up anywhere near the full number. So there is some guidance that is coming out any day about carers who wish to contact the local authority to receive a carers assessment. There is some guidance about the definition of who will be eligible. So it is someone who is providing in a unpaid caring role for someone who is vulnerable and at risk of catching COVID. So it won't be every carer, but that guidance will be coming out fairly soon. So people who are on carers allowance, people who are known to GP registers, and people who are known to the local authority will have already been invited to attend for a vaccine. But we know there's a significantly large group of others who we will be inviting to contact the local authority in the next week or so.
Thank you, Roger. Kim, you definitely have the power. As soon as you spoke, Roger, Mark, and Joe put a hand up. So, Nigel, do you want to come back in and finish the second point before we go to
yes, there are, and I'm sure this is probably a point that Mark would like to also pick up on. In terms of those people that are housebound, the actual figures for Thurrock are not that bad. Actually, there is quite a considerable number now have been completed. It's over 87%. Obviously, that's not enough. We need that to be 100% or as close to 100% as we can make it. Certainly there is a plan because this is something for the GPs really that they've been looking to target, and certainly our CCG colleagues have developed a plan to ensure over the next few weeks that they really try to ensure that everybody receives that first dose, and that for that group particularly, that and care homes are still top priority.
Thank you, Nigel.
Thank you.
Mark.
Yeah, just making the same point really. The focus now is to make sure that everybody in those initial cohorts have actually been vaccinated or offered the vaccination. The note I got just before this meeting was the same numbers that Nigel had, so kind of 87% coverage, and that the 24 remaining housebound patients have been booked for their vaccines. So, you know, we are looking at quite low numbers now, and the PCNs know them by name and are targeting and making sure that they are offered the vaccine. So yeah, I appreciate that's coming through. And Kim, if it does come through to you, if you come to me or Rahul or Romy, then we can sort of chase them up on an individual basis. We need to make sure that we get everyone.
Okay, Joe.
Thank you, Chair. I just wanted to add to what Nigel was saying about inequalities and targeting vulnerable groups and our BAME community in particular. So just wanted to reassure the committee that Public Health are linking in with our NHS colleagues on this, and we're working with Kim and her colleagues on it as well. And we've also commissioned a particular piece of research. It's engagement-based research with our local BAME community to really understand issues around vaccine hesitancy hesitancy among our community. So just wanted to let the committee know that was happening.
Thank you, Jo. I've seen Councillor Abbas has done a video that he's put out on his social media, and I think it's brilliant. I've been sharing it, and I hope everyone does share it to try and drag that population in to get the vaccine. I know a lot of it is based on culture and beliefs and all that, but that engagement and getting people within their community to spread the word about how important it is to get that vaccine is our way out of this. Councillor Mardoni.
Yes, thank you, Councillor Ralph. It is good to see that the vaccination rollout is happening so well and so rapidly, and also to have the first news of the impact that it's having in that older age group. So that's all very, very positive news. I'm just wondering about, are we going into the realms of second jabs yet, and how is that working? Will people be called to have their second jabs, or I know there's a number of different systems operating. I heard about the hospital hub system and what they're doing about it. I suppose it's going to be a little bit different in the community, and maybe different with each practice or other venue that we're doing the jabs. But obviously, are people coming up for their second jabs now? They must be getting them back.
If I may jump in, Councillor, yes, a number of people that were the early from sort of cohort 1, 2 are shortly falling due, and some are falling due now in very small numbers for their second vaccinations. That will certainly ramp up quite dramatically during April. The process is that the acutes have got their own booking system that they have used periodically, similar to the PCNs. As the lead for the vaccination centres, we're very much tied into the national programme, which is the national booking system. And those people that book through that for their first vaccination could also book their second vaccination. And there is a timing window of about 2 weeks or so in which you need to take your second vaccination. So we've put in a number of processes, and I'm sure that my PCN colleagues and acute colleagues are doing exactly the same, just to double check that everybody's got the opportunity to book that second vaccine. What the centre have done, as colleagues I'm sure will be aware, is every time they receive a supply of the vaccine, they hold 50% back, so that everyone who has a first dose is guaranteed a second dose. That should be less of an issue now that the production of the vaccine is really taken on board. And so we are going to see a significant uplift in the supply of the vaccine now across the UK. And we've been told that these significant volumes will start to hit the UK and therefore hit Thurrock, along with other place-based systems from the 15th of March.
Thank you, because I know sort of in my ward, the vaccination centre that's there from the local surgery, they have mostly been ringing people to book appointments. So that would if that's what they've been doing the first time, that's probably what they're going to be doing.
Yeah, as this is a public meeting, I think it's very important that we stress that it's very, very key for people to go back where they can to the first site that they had the vaccine. That's particularly true of the acute and primary care, because most doses that were given were the Pfizer vaccine. The vaccination centres themselves give the Oxford-AstraZeneca vaccine. So there's a slight difference, and it's important that you receive your second dose is the same vaccine as your first dose.
Okay, thank you very much.
Thank you.
Brilliant. Thank you, Nigel. Ian, do you wish to add anything?
I don't think so, Chair.
You're just looking so chilled there. I thought I'd just call on you. Brilliant. I mean, this vaccine is such a good news story for Thurrock. We're pushing it out. Our systems are working. We're getting to the people that need it. It's one of those things that we can hold our head high, and it's good. We're doing everything we can to make our population safe, and thank you to everyone who's working on this. I know that some of your staff and volunteers have been burning themselves out doing this, and volunteers working without breaks and everything. It's just an incredible display of compassion that they're showing to help get this out. So again, I wish you could pass all those thank yous onto them from us. Does any member have anything else to add? Nope. Great. Thank you, Nigel, again.
Thank you, Chair. Thanks for your comment.
Thank you. So now item 10, which is, Elizabeth, Councillor Rigby. Or she just dropped her phone.
Oh no, sorry, the dog's playing. Thank you. Sorry, I just wanted to ask if you have any figures on the number of residents with long COVID. I just noted in your figures that there's an awful lot of sort of in the 30 to 39s getting infected, and while they might not get very ill, how many are sort of suffering with long COVID symptoms?
Does anyone want to come in on that?
I think the answer to that is no, we don't have accurate data at the moment. Unless Joe wants to contradict me, she may have some data I haven't seen. It's quite a difficult syndrome to diagnose, and it's something that we're learning about at the time, but I haven't seen any local data. We do know roughly the percentages of people that we think are likely to develop long COVID, but I don't have any accurate data I'm prepared to or want to hazard to put into the public domain off the top of my head at the moment.
Okay.
Okay, thank you. Do you know, will we get that in due course, that data?
Possibly. As I say, I suspect that it is underdiagnosed, so the data that we do get may not be the true picture. But I mean, we should theoretically be able to pull that off a system like MediAnalytics in time, but that runs with a 3-month data lag. But I suspect it will be a underestimation of the true prevalence.
Okay, thank you. Just one quick question that's just popped into mind, was the new variants. Do we have any information on new variants within Thurrock at all?
I can come in on that, Chair. We don't have any. We are not aware that there are any of either of the South African or the Brazilian variants within Thurrock. There was obviously some within Essex, and there was the surge testing that was done. I think 9,000 people or thereabouts were tested. Public Health England, I used to work for Public Health England, and so I'm quite au fait with their internal processes, but Public Health England are very, very hot on this. So if there was a case that was identified, they would let us know straight away. And there's a surveillance system where about sort of 7 or 8% of all tests, all PCR tests, are sequenced. For some reason, we seem to have had higher than sequenced in Thurrock, and I think that's maybe because we've been doing quite a lot of testing. So there is a system out there. We can't say for definite there isn't a variant in Thurrock because we haven't got 100% sequencing, but there is a good system that if it was widespread, it would probably be picked up.
Brilliant. Thank you. That's reassuring to know. Okay, moving on to item 10. This is the work programme. This can be found on pages 13 and 16. There are items on the work programmes that can be carried over the next municipal year. Does any members wish to comment? Councillor Holloway.
Thank you, Chair. Just a quick one, just to add the JSNA into the list, just to make sure it kind of goes on at some point next year. And I'm not going to call it what it is. Maybe the Health and Targeted Unemployment JSNA, maybe.
You want to come up with a new term?
Yes, 100%. But that's all. Thank you, Chair.
Thank you. It's quite a strange one. It's something that over the years we've used a lot. So it is it has a tang to it that isn't quite nice, I guess. Okay. The other thing is obviously adding on to 6 months onto the work programme of Basildon Hospital Maternity Unit to be put back in. And I think there might be some programmes coming up in the future. Again, as we move forward after the elections that are all coming up, I hope I'll be back. I've enjoyed being the chair so far. Again, I appreciate everyone for turning up tonight and for all the work that you put into. It's been quite a heated conversation tonight, and we've covered some topics that I think have been long overdue to be discussed at length. So I do appreciate you all coming on today. Councillor Mardani.
Just wanted to say thank you very much to Roger. I'm sure other people have known you much longer, but in the nearly 2 years that I've been a councillor, it's been an absolute pleasure to work with you, and thank you for all the help that you've given me in your role over those 2 years. It's been a real pleasure, and wish you all the best for the future.
Thank you very much, Councillor. And I know I've still got a couple of housing cases you want me to resolve in the next week or so while I'm still here, but thank you.
Chair, if I could also just echo that, obviously, yeah, so sad that you're leaving, Roger. I mean, it's such a shame that that it wasn't kind of mentioned at full council as well, because that would have been your last full council as well. And I think there's just something really important about just really acknowledging, and I know that every councillor, not just us that sit on HOSC, you know, housing, you know, I'm sure they've all you know, said that already at maybe housing scrutiny that's already happened, but a huge thank you. You are going to be hugely missed. You know, we are lucky that we've got Ian stepping up, and that's fantastic, but you really, really will be missed. And don't forget about us. Keep in touch, and I hope you really enjoy whatever you do next.
Well, I'll put the dates of HOSC in my calendar, and I'll be watching them on webcast.
I don't believe it.
No.
You'd be mad.
Good luck, Roger.
Please.
I'd like to echo my thoughts. Roger, you was one of the first officers that I met once I was elected, and sort of told me how to work things and how to put procedure into place when it comes to housing. And I know you've helped me on numerous occasions over some cases, some happy and some sad, unfortunately, recently. But again, you know, you've come across to me as such a nice person. It's a shame I've only known you for a couple of years, and other people have had the pleasure of knowing you much longer. But I've not heard a bad word about you since I've been here in those 2 years. So that says something.
Thank you.
Okay, brilliant. So the time is now 9:49, and the meeting is now declared closed.
Good luck, Roger.
Thank you.
Bye.
Thank you,
Thank
Roger.
you.
Thank
Good
you.
evening.
everyone.
Thank you.